Ian, do you know if Jenny was going to join us for the meeting?
Yeah, I think she's having some technical issues, but she should be joining us soon.
Okay, we'll wait just another minute then.
Rob, do you care to send her that link again? I think she's having some issues with her link.
Not at all. I'll do that right now. There's a Pam Brown also trying to get in. Is that okay?
Yes.
Yes.
Okay.
All right, that is everybody. As soon as Pam's connected, my dialog box says she's still getting connected. As soon as Pam's connected, we'll go ahead and get started. And it looks like everybody is fully connected. Mr. Link, are you ready?
Yes, sir.
All right, good morning, and thank you for joining us for this public hearing on the Knox County Community Development Program Year Consolidated Annual Performance and Evaluation Report, or CAPER. I am Dwight Vandevate. I'm the Director of Community Development for Knox County. Today's date is September 24th, and the time is, September 24th, 2020, and the time is approximately 10:30 a.m. Now about 10:34. This virtual meeting format has been approved by HUD due to the COVID-19 pandemic. It is being live streamed on the internet by Knox County. It will also be archived and will be subsequently available on Knox County's YouTube channel. The Consolidated Annual Performance and Evaluation Report, or CAPER, is a required annual report by the U.S. Department of Housing and Urban Development, or HUD. The CAPER is comprised of statements, statistical and financial statements, narratives, and maps describing activities carried out during the 2019 program year. The actual CAPER document itself is available on our website at knoxcounty.org/community development. Today, our grants program manager, Mr. Ian Christie, will provide an overview of the CAPER. And again, the document is available on our website, and you can offer any feedback that you may have through the email address of cdfeedback@knoxcounty.org. In addition to Mr. Christie, staff on the call also include our senior program manager for housing and homeland security, Mrs. Jenny Holden. I'll spit that out. Our regulatory compliance monitor, Mr. David Lara, and our staff accountant, Ms. Pam Brown. Appreciate all of them. We've had a good year. We also want to thank Mr. Rob Link for facilitating this call, and Mr. John Guyman for IT support throughout the year as well. Finally, before I hand the call over to Ian, we should offer a word of thanks to our local HUD office as well, in particular, Mr. Eric Hoagland, Jenny Stewart, and April LeMaster, who support us through the year in the work that we do, working with social service and housing agencies throughout Knox County. So with that, I will hand it off to Mr. Christie, and again, we appreciate your attendance.
Okay, thank you, Dwight, for the introduction to this meeting. I'm just going to do, as Dwight said, an overview of the CAPER. Now, the time period that we are looking at is July the 1st, 2019 through June 30th, 2020. And this is also the last year within our 2015 to 2019 consolidated plan. The amount of funding that we received from HUD in the time period for this CAPER, for CDBG, it was 1.2 million, specifically $1,220,119, and for home, $416,855. And I'm going to just go run through what we spent the allocations on this year, or this past year, and some accomplishment data, and then some other information. So the people and households that we served through our funding, and we used agencies through our community to administer these funds. We served a total of 7,735 individuals and households in this past year. I'm going to break that down into housing and then public services. We served on the housing side, we served 127 households and individuals. That was through 4 different projects, including the CEC housing project and neighborhood housing, Operation Backyard, and they were both minor home repair programs. We also provided funds to Sertoma for supportive housing rehabilitation and to Catholic Charities for some facilities rehabilitation within their portfolio. Moving on to public services, we're going to break this down into 2 subcategories, just general public services, and then specifically those public services that relate directly to homelessness. On the public services side, the general public services, we served 1,908 individuals, and that was through agencies such as Breakthrough for Community and Employment Service Program for Autistic Adults, for Helen Ross McNabb through their mental health services programs, through Home Source East Tennessee through their care coordinator at one of their senior living facilities, Knoxville Academy of Medicine providing links for affordable medical coverage and facilities for low to moderate income individuals, Knoxville Area Urban League for home buyer education and counseling, Neighborhood Housing Workforce Development Program, and Volunteer Ministry Center, their dental clinic. And just to note that all our funds should be directed towards low to moderate income individuals within our community. Now, moving on, we also provided funding for 3 agencies: Public Defender Community Law Office, the Volunteer Ministry Center, the Bush Family Refuge, and the University of Tennessee's HMIS program. And all those 3 programs directly related to homelessness and serving those who are experiencing homelessness throughout this past year. And again, we served 5,700 individuals through this area. Moving on to our goals for this past year. So our housing goal was 170, and the actual number we were able to serve through our funding was 127. That was 75% of our goal. And the reason we did not meet our goal was due to the current COVID-19 pandemic. There was several months this past year, from March all the way through to June, where some agencies were not able to do any construction, and all the related delays to that. Moving on to public services as a whole, which include the general public services and homelessness, our goal was 5,965, and then the actual number was 7,608 individuals that we served, which was 127% of our goal. I think that shows the need through the pandemic of individuals needing assistance. Then moving on to our strategic plan goals. So the 5-year numbers, as I mentioned earlier, we were in the last year of our consolidated plan through June 30th. So in 2015, in our consolidated plan, we had a goal for housing of 1,110. At the end of our 5 years, our actual numbers served were 1,188. So we were at 107% of our goal. So we exceeded our goal for housing. Moving on to public services as a whole, our goal was 47,000, and our actual number at the end of the 5 years, through the end of June 30th this year, was 39,312, which was 84% of our goal. The reason we did not meet our goal was due to the way that the University of Tennessee HMIS, they calculated their numbers slightly differently throughout the consolidated plan period, and that resulted in a reduction in our expected numbers. Now they're still serving many people who are in need, and we're very happy and grateful for the work that they do within our community, and serving those who are needing help. Just I wanted to mention that our average accomplishment of the people served and households served throughout each of the 5 years was 7,862 residents within Knox County, which is a significant number. Moving on to income levels of those served. In housing, we served 71 individuals in households that were in the 0 to 30% category, which was 56% of the total served. The very low individuals, 31 to 50%, that we served 35 households, and in the low to moderate, 51 to 80%, we served 21 individuals and households, which was 16% of our goal. Moving on to public service, in the extremely low 0 to 30% category, we served 6,836 individuals, which was 90% of our goal. 7% of our goal, which resulted in 527 individuals being served through the agencies that we work with, whereas in the 31 to 50% category, and in the low to moderate income category, 51 to 80%, we served 239 individuals, which was 3% of our goal. Some other accomplishment data I would like to share in our meeting today is we served 2,161 female head of households throughout the past year. We also served 516 elderly head of households, and we served 582 individuals in households identifying as Hispanic or Latino. I want to highlight one project which we actually unfortunately had to cancel in this past year, which we included in our annual action plan for FY19 or PY19. Florence Crittenton Agency applied, and we provided them funding for housing rehabilitation for youth victims of human trafficking. We provided them with $100,000. And due to the conditions relating to the pandemic, Florence Crittenton determined that non-CDBG leverage funding earmarked for this project could potentially be used in areas of greater and immediate need in the current environment, specifically the COVID-19 pandemic. This remains an area of interest to Knox County Community Development, and we hope to revisit this project in the future. I want to just move on to the final part of this, is that we are looking for public comments into this CAPER. You can access all the information on knoxcounty.org/community development, which is our website. We also would love or like for you to provide the information to us by email in cdfeedback@knoxcounty.org. And if you would like to write into us by mail, that is Knox County Community Development, 400 Main Street, Suite 630, Knoxville, Tennessee 37902. You can also leave a voicemail at our office by phone at 865-215-3980. The comment period will end at midnight on Friday, September the 24th, 2020. All comments received by that time will be incorporated into the final plan, and we intend to submit to HUD our CAPER report to HUD on September the 30th, 2020. We appreciate all the work that the agencies are doing across Knox County in this difficult and challenging time, and we thank you for that. This concludes today's public hearing, and we thank you for your attendance.